This outbreak and school closure places a huge burden on families, many of whom are low income and can't afford to miss work, or are newcomers and may not be able to facilitate learning at home.
As cases continue to grow in a school outbreak, we're learning more today about the school's community and how it could be uniquely vulnerable. Plus, more reaction today to this photo. The public weighing in on the mayor breaking COVID rules. Not yet time for snow. We're gearing up for a period of rain over the next couple of days. Colette Kennedy will bring you your full forecast for the week later in the show. I'm Katerina Georgieva. Chris is off tonight. Cases are continuing to climb in what's already Ontario's largest school outbreak. Health officials say there are 41 cases of COVID-19 at FW Begley Elementary School, and it's raising concerns over how this record spike affects a uniquely vulnerable population. With more, let's go live now to the CBC's Sanjay Maru. Sanjay, what concerns are you hearing?
Well, Katerina, I'm hearing that it's all tied to the demographic characteristics of this school community. Health officials have previously said that access to technology and language barriers have been an issue for the health unit trying to address this outbreak with families in this school community. Now, health officials did say today that if this virus were to make its way through other schools in Windsor, Essex, similarly to how it's done here at Begley, they would consider making a call for a temporary full-on shutdown of all schools in the region. But first, more work, they say, needs to be done to understand what really happened here at FW Begley.
If that transmission happened as a result of something that we can fix, obviously we would want to do that.
It started about 2 weeks ago with 3 confirmed cases. Today, 39 confirmed and 2 probable at a school with many students from newcomer families. It's something one local researcher says can complicate containment on the outbreak.
Many newcomer families are multi-generational households. So you have everything from grandparents to grandchildren living under one roof.
That means more people who could potentially carry the virus, and for low-income families, the concerns spread further.
Low-income populations tend to use things like public transit more often, which puts them just in contact with broader communities. They're also more likely to be working sort of lower-paying frontline employment, jobs that don't allow, like myself, who can work from home. They're not able to sort of do that.
The public school board says it does not track socioeconomic data for its students. Today, CBC News asked the health unit how exactly it's able to assist Begley student population without it.
We do work with the school boards and the school principal to determine the needs of their school communities. So if there are language needs or any other identified issues that we can assist with, that is a communication between typically the school principal and our nursing staff.
This outbreak and school closure places a huge burden on families, many of whom are low income and can't afford to miss work, or are newcomers and may not be able to facilitate learning at home.
The MPP for Windsor West pointing to the Begley closure as a reason for capped class sizes, but the province says all the right steps are being taken to keep kids safe.
While we see increasing rates of community transmission, there's been an incredible resolve and demonstration of collaboration between public health units in Windsor, Essex, and the local school boards.
And Lecce, they're pointing to steps like in-school testing that was set up for students and their families over the weekend, and the immediate switch to virtual learning for all students.
Now, Sanjay, this isn't the only school with cases, so bring us up to speed on where else we're seeing COVID.
Well, Katerina, there continues to be that outbreak at W.J. Langlois Catholic Elementary, and let's show you some new information reported today by the public board that there seems to be, or rather the public board reporting 1 case each at Massey Secondary School and Bellwood Public School, and just yesterday 1 case at Sandwich Secondary, a 2nd case emerging at Riverside Secondary, and a 2nd case at Tecumseh Vista Elementary. And you can find the full breakdown of all these new cases on our website, cbc.ca/Windsor. Katerina.
Thanks, Sanjay. The CBC's Sanjay Maru reporting live. Public health officials are warning that Windsor-Essex is on a dangerous trajectory. More outbreaks and 55 new cases reported today. 3 new outbreaks reported as well. A place of worship in Leamington, an agriculture workplace in Leamington, and a housing complex in Windsor, Riverside Place residents. And there are still 5 outbreaks at long-term care and retirement homes, but one home in particular has seen a jarring spike. Riverside Place just yesterday had 1 confirmed case, but that's gone up overnight. Now they have 17 cases among residents, 2 among staff members. The health unit says it's keeping a close eye on the situation.
They're all positive in such a short period of time, so we will be looking at those cases very carefully just to make sure that we are not missing anything, because it is unusual to have that many positive just in one day with testings.
Strong reactions today to the photo showing Windsor Mayor Drew Dilkens breaking COVID rules. We were first to tell you last night about how the mayor dined at a table of 8, just hours after vowing to crack down on those who didn't follow restrictions. Jacob Barker is in studio today and he joins me now with more. Jacob, what are people saying about this picture today?
Well, Kat, people have a lot to say. Our story was shared hundreds of times along with hundreds of comments. And even with the response from the mayor taking responsibility for it and promising to pay a $750 to charity, the amount equivalent to a ticket for an infraction, people for the most part were not in a forgiving mood. Here are some of the comments on our story. Stephen Hayward wasn't alone in using the quote, "Do as I say, not as I do." But he added, "This is not how you lead by example. People are losing their businesses and going bankrupt while he flaunts his wealth in front of people. Very irresponsible." Beth Trottier says, "The only thing stupider than breaking the rules is having a picture of yourself breaking the rules, and they're sitting shoulder to shoulder while the rest of us are dining in small groups." And while most of the comments were negative, there were a few that gave the mayor a bit of a pass. Here's one. Mirza Beg says, "It's unfortunate the way some people here are dissing the mayor. He accepted his mistake and is going to pay a fine and donations. What else do you want from him?" And while the mayor and at least 2 others at the table have agreed to donate to charity in lieu of a $750 fine, many, like Kathy Miller, were asking, why isn't he being fined?
So that's a good question. So is he or is anybody else in the picture going to be fined?
Well, that is something that we asked the health unit about this morning, and the indication from Dr. Wajid Ahmed, medical health officer, is that no, they are not exploring fines for anybody. He says that it's difficult for them to lay any sort of charge if none of their staff was on site to observe the infraction, but he did also answer what he felt about seeing the picture of the mayor, given that just a few hours earlier, he had been at a meeting with all of the mayors in the region talking about getting tough on COVID restrictions.
I think all of us need to show and lead by example, and not only just to show. I think it's more to feel. What do you do? So I think this is also one of those responsibilities that we feel here, and we want to make sure that everyone feel that way. The community needs that, and all of us need to be in this together to support everyone. And I think it's we have to be more responsible. That's all I can say.
Well, I did hear back from one other person sitting at that table. Gordon Orr, the CEO of Tourism Windsor Essex Pelee Island, wrote in an email that his only comment would be that it was an error to be seated at that table of more than 6, and that he takes responsibility for it, and that he would be donating $750 to a charity of his choice. Kat?
Thanks, Jacob. The CBC's Jacob Barker reporting live. And more questions will likely come up tomorrow morning. Mayor Drew Dilkens will be joining Windsor Morning host Tony Doucette. That interview will be on at 7:40 a.m. You can tune in at 97.5 FM in Windsor. You can also stream it on the CBC Listen app. 14 more people have died from the coronavirus in Ontario, including a person under the age of 19. And a data error led to a lower than usual number of daily COVID-19 cases reported today, just 1,009 cases. But the Ministry of Health says yesterday's figure included 8.5 hours worth of extra data, meaning the total count was inflated. So today's lower number adjusts for that mistake. The Premier used his daily press conference today to show off the COVID rapid testing kits. They're now available in the province. The kits promise results in as little as 15 minutes. Lorenda Redekop now with details on where the first deliveries are headed.
My friends, the new rapid tests are game changers.
The Premier spoke at Humber River Hospital, one of the places where they'll start rapid testing.
If someone knows they have this terrible virus, they wouldn't go to parties, they wouldn't visit their grandparents, and they wouldn't spread it to their neighbors or friends. That's the difference testing and screening can make.
The government says it has 2 different brands of the tests so far, a total of 1.3 million tests from the federal government, with another 1.5 million before the end of the year. The Premier thanked his federal partners with a little dig.
Because I was up here jumping and screaming for 2 months to get these done, so I want to thank Health Canada for getting these in.
The government says the tests are already being used in a few dozen long-term care and retirement homes.
We did not waste any time moving forward with them because we know that they are badly needed in hospitals and long-term care homes, that where we need to have a faster response, and in some of our more northern, more isolated communities.
One healthcare union that represents personal support workers says this will help identify cases faster, but isn't a solution, saying in a statement, without adequate personal protective equipment, proper staffing levels, cohorting, and strong infectious disease protocols, our frontline healthcare workers in long-term care will remain at serious risk. This PhD student sees major potential in these tests. He says in Slovakia, they tested their entire population over a few days. 1% came back positive. But he says they're especially useful to protect the most vulnerable.
I think that has potentially huge benefits in a long-term care setting because you can do everything everything we do to have these kind of specific defense mechanisms in long-term care, but if you have it spreading in the community, it's going to get into those settings eventually.
The health minister says they'll also be used in hotspot neighborhoods. Plus, they're starting a pilot project for some workplaces, which could allow more businesses to reopen in the future. Lorenda Redekop, CBC News, Toronto.
An historic moment for Caldwell First Nation. It's attained reserve status for a parcel of land in the Leamington area. The 200-plus acre property is at Seacliff Drive and Bevel Line Road. The announcement comes 10 years after a $105 million land claim settlement and more than 2 centuries after their land was taken from them by the Crown. Officials at Caldwell say the new land will create housing and jobs for the nation. Plans include a residential development and community facilities. The nation would have liked to hold a large community celebration, but they'll hold off on that because of the pandemic. And they will be planning an outdoor event for sometime next year. The Minister of Crown Indigenous Relations, Carolyn Bennett, said in a statement, creating a land base for Caldwell First Nation is an important step in the history of Canada. Today, we're able to right a historical wrong, advance reconciliation, and support the treaty relationship with Caldwell First Nation.
It's absolutely phenomenal. It's undescribable feeling. I'm sure all the members in our nation are feeling the exact same thing. It's just indescribable. It's something that we've all worked for and hoped for the longest time.
Being able to finally address some of those issues and start to bring the community back together will really foster reclaiming our language, reclaiming our culture and our traditions. So it's not just about providing a home and providing housing, it's really about connection back to the land, connection back to our people, and getting back to that community and tight-knit orientation that our people were so used to.
There could be changes coming to the way things get built in the province. The people in charge of conservation areas say the government is further limiting their role, and it could lead to changes in nature-based programming across southwestern Ontario. Our Chris Ensing has more.
Maybe you've been here before. John R. Park Homestead, built in 1842, and right now it's operated by the Essex Region Conservation Authority.
This entire property was transferred to us by the province, challenging us to rise to operating it locally, which we've done, but now further limiting our involvement with it and our capability to levy money to support it.
More limitations are found in Ontario's proposed budget bill. The government wants to change how the 34 conservation authorities across Ontario operate.
This type of wholesale sweeping changes we've never observed before.
Overall, IRCA says the key changes, quote, could potentially remove science from the equation. They say changes could green light developments like houses, buildings, subdivisions that, quote, may be considered unsafe. Those comments are backed by the Lower Thames Valley Conservation Authority, which covers Chatham-Kent, both highlighting a key change. It gives a Minister of Natural Resources power to approve a permit or project themselves without input from the Conservation Authority.
They've taken a sledgehammer or an axe at something that needs to be carved with a penknife.
Rick Nichols is the provincial member of Parliament for Chatham-Kent Leamington. He supports the budget bill and the changes.
These programs are going to continue. They will continue so long as they're funded through self-generated revenue. Self-generated revenue is different from government-funded, of course. But so they have to get creative.
The act will push authorities to record minutes at meetings, publish agendas, and make public annual audits. Conservation authorities support that, but say changes will make getting a permit for a dock or a shed more difficult.
I have no problem creating new processes for our permitting, but this isn't going to work.
The province makes up a small portion of IRCA's budget. A municipal levy funds 32% of their 2020 $10 million budget. The levy is about $20 a household a year. That's what funds programs like the ones at John R. Park Homestead. The proposed changes force IRCA to enter into separate agreements with individual councils instead of through the levy.
It provides another challenge to basically operate this type of facility. And it creates more work, time, and cost to management to attempt to go out to try and raise funds to maintain the operation of it.
Both IRCA and the Lower Thames Valley Conservation Authority want the changes repealed. Nichols says he's always open to hearing from regional stakeholders. The Conservative government has a majority and can push these proposals through as early as next year. Chris Ensing, CBC News, Windsor.
Some light rain in Windsor right now, and there is more on the way. When we come back, Colette Kennedy will join us with the weather. Colette Kennedy joins us now for our weather forecast. Colette, it looks like we've got some gray, rainy days ahead.
Yes, we do. It's that kind of period we're going through with this storm track, and we're seeing another system that's rolling through. And since you asked me earlier, Kat, I think it's a good place, instead of burying this in the middle of my forecast, I'm going to pull it right to the beginning so we can start with it. How much rain? Because I think that's on folks' minds. How much rain are we looking at? It's not a ton. We're talking about between tonight, and there'll be breaks in the precipitation. It's going to be somewhat intermittent, but then through tomorrow, probably in this range, say 10 to 15 millimeters of rainfall all told. Now, there's still a risk into Thursday, especially early in the day, but I think primarily we're going to get this through on Wednesday and then some of the cloud cover and lighter stuff into Thursday. So our current temperatures, they are above freezing. That's why we're seeing, there are areas close by where it's more of a mix, but we're seeing the rain showers. But I'll tell you, the temperatures are actually going to be coming up further. So that's only going to continue to help us with keeping it in the liquid form and not into some of this wet snow mix. Now, there could be times it's very highly localized where you get a few spots where we get a pocket of colder air aloft, and you're going to get a bit of a mix, but primarily for us here through southwestern Ontario, we're into the rainfall with this system as it comes through, because those winds will be switching direction and those temperatures coming up. As we work our way through the overnight, here's one of those breaks showing up, just a break in the precipitation, then it's coming back towards tomorrow morning. So you want to be prepared for wet weather, get the kids prepared for wet weather, because it will be back even if it leaves us for a little bit. Then even tomorrow evening, filling back in once again. And this is what I'm talking about for Thursday. We're doing much better. We're drying out, but a lot of cloud cover still holding in there. So consider ourselves lucky if late in the day we can see any breaks. I really expect we're going to have to wait till Friday for that. So we will get some of the milder temperatures coupled with some better sky conditions at the end of the week. That's something to look forward to, right? Overnight tonight, I said those temperatures would be rising, so it gives you a look at this. Now, Sarnia more of a mix, and certainly some light wet snow towards London before that changeover. Then tomorrow afternoon, those temperatures going a little bit above seasonal, and then we kind of stick there as we look through the 5-day period going forward. So Thursday, drier, 11 degrees. Yes, we're likely to get to double digits here, but Friday's the day that I'm sort of looking at as maybe the nicest day to get outdoors of the next few, and then into the weekend. That's certainly not looking like a bad forecast either. We're seeing those temperatures still riding a little bit above seasonal, and more sunshine and drier conditions into the weekend before the next storm comes in the beginning of next week, by the way.
You know, it's nice looking at that. It's like some light in the week of gray, you know, just a crack of light coming into the dark.
Yes, you need that. We all need that.
We all need that sometimes.
And literally.
Absolutely. We all want to hang on to, you know, anything that brings us joy, and that brought me joy. So thank you, Colette.
Yes, you're welcome.
When we come back, the medical officer of health had a powerful message for the community today about coping with COVID and making it across the finish line. Stay with us. There's never been a tougher time to be a nurse, and that can be a challenge when trying to recruit, especially in the middle of a global pandemic. One ER nurse spoke to potential new hires in a virtual health career fair.
These last 8 or 9 months since the pandemic start have been probably the most challenging part of my career to date. We have supported the staff, and we ourselves have all been going through an immense amount of change.
She added the work she and her colleagues have been doing is very rewarding. Other speakers stress there are many important jobs at the hospital, including pharmacists, clerical workers, and counselors. We've been hearing from public health officials that our region is in bad shape, but the medical officer of health says despite the fatigue, he remains optimistic. He looks forward to the impending arrival of the vaccine, and he's hopeful the community can turn things around.
I know, and I totally get it. People are tired. I am tired too. Trust me, I am. Like, I haven't taken any vacation days. Teresa hasn't taken any vacation days. We're not doing anything other than thinking about COVID. Even in my dreams, I'm thinking about COVID. So trust me. It is important that I think people know that the end is near, and we all need to be sticking together, supporting each other, and take everyone with us. And I think that's the key part. If we cross the finish line, once we declare the pandemic is over, we want to take each and every one of our community members with us. We don't want to leave anyone behind. We don't want to leave and behind, to be blunt, we don't want to leave people dying and then only us who can move and follow that and think, it doesn't affect me. I am fine. Even if it affects me, I'll be okay. No. As a community, we have our responsibility. We want to take everyone with us and cross the finish line and say we have conquered COVID.
A powerful message there. That is it for CBC Windsor News. Don't forget, for news anytime, you can go to our website, cbc.ca/Windsor. We're on social media as well. You can check us out on Facebook, Instagram, and Twitter. The Rick Mercer Report is up next. Have yourselves a wonderful night.